Hello, everybody, and welcome to another episode of Mind Matters, Navigating Head Injuries and Concussions. I'm your host, Kylie Como. I'm the legal nurse consultant here at Shane Smith Law, and today we're back with our friend, Dr. Mackenzie Lorario, a medical doctor specializing in neurology, as well as a researcher, a published author, and a speaker. Dr. Lorario, it's good to be back with you today.
Thank you for having me back.
Yeah, of course. And again, to our audience, if you've tuned in before, you know we love to dive into the brain and all things related. So again, let's jump in, Dr. Lorario. I want to get back to something you mentioned earlier. You were talking about the brain structure and its role, specifically with I think it was the amygdala and its importance in stress and emotion. So, with TBI, we see a lot of it at our firm, that comes with a good deal of emotional dysregulation a lot of times, concussion react. So with that, what role might you talked about already a little bit, stress, trauma, like we're talking about here, or even emotions play in somebody with FND?
Yeah, so I'll start by saying, in addition to being a neurologist, I'm also a trained psychotherapist. And before moving here to Philadelphia, I was practicing psychotherapy in a practice in Manhattan, treating people with FND. So I do have that other mental health treatment side of things that I have experience with. And I would say that psychotherapy is an important part of the treatment for FND. It's been clinically studied. There's multiple studies that show that a few types of mental health treatment can actually help reduce or improve symptoms of FND. And the most studied one is something called cognitive behavioral therapy, or CBT. And that helps us identify how our thoughts, our emotions, and our actions are all interrelated. And understanding that can really give us a sense of how our emotions are related to our FND symptoms. And as an example, I see there can be a lot of anxiety that can be a trigger for symptoms. One typical thing that I might hear is, say a person has functional seizures, and if they leave the house and have a seizure in public, it could be very embarrassing. The person could lose consciousness, shake, 911 could be called, they're taken to the hospital. They might not be treated well in the hospital because of these misunderstandings of FND, that the doctors may be upset with them because they think they're faking their symptoms. And so this person might have anxiety about leaving the house because they might fear they might have a symptom and then be exposed to all of that. And if they feel that anxiety, they start paying attention to the fact that they might actually develop a seizure. And that will create more anxiety. And as we know, paying attention to your symptoms could actually be a trigger of neurological symptoms in FND. So there could be this kind of loop where we actually want to cause a break and allow the patient some time to address the anxiety in a different way than how they're currently doing it, which is to worry and ruminate about, maybe I'll have a seizure. And so stress reduction is a big part of that, various coping mechanisms, sensory soothing mechanisms, breathing and mindfulness exercises. There's a lot of things that can be done to respond to those mental health symptoms that could trigger FND symptoms. I also see, just in general, most people who come to me who have FND often have stressful life events that are occurring: death in the family, dealing with chronic illness, being a caretaker for somebody who might have health needs, recent exposure to something traumatic of various types, whether that's physical or stress or emotional or sexual. All these things need to be dealt with, and they're stressful. Chronic stress can do a lot of things to the brain that can result in a lot of health consequences. So to kind of take the time to say that this is our brain calling out to us that we need to start addressing some things that we may not have had in our conscious awareness, or just have kind of put aside as something we're not dealing with for now. This is a time to go into mental health treatment and receive the evidence-based, clinically proven treatment for FND, which is psychotherapy. So that's kind of where I approach things. And also, I will say that physical therapy is also an evidence-based clinical treatment for this. So I don't want to discount the importance of physical therapy for the treatment of FND, but I'm just wearing my psychotherapist cap right now and want to advocate for the mental health treatment component of things
Mm.
because of the stigma of FND. Many times patients don't want to enter psychotherapy even if they need it because they don't want to be under the assumption or have people think that they're crazy, quote unquote, or that it's in their head or they're making up their symptoms.
Yeah, that's again such a great statement there. We have a lot of, again, a lot of our own clients, with traumatic brain injury, concussion. The treatments are limited, especially when it's this quote unquote mild TBI, right? There's no structural issues there, so there's no procedural interventions, if you will. So largely it's medications, which then you start dealing with like polypharmacy, and that creates a whole other, realm of issues depending on their overall health or any number of factors, really. But yeah, when it gets down to it, a lot of those psychotherapies, you mentioned cognitive behavioral therapy, we see that being recommended, but you're right, patients are just very hesitant because of, whatever stigma, all of that. So that's such an important thing to reinforce. And I'm glad you're out there, kind of championing that for, if you will, definitely needed. Aside from psychotherapy, are there any other treatments that you typically see for FND that you see a lot of, rather?
There is no medication that treats this. That's often a question that's asked of me. There were some studies that looked at SSRIs, selective serotonin reuptake inhibitors, and those antidepressants were not found to be effective in some small randomized studies. So really, we would treat with medicines any other comorbid, co-occurring mental health treatments, whether that's mood symptoms such as depression or anxiety, PTSD. We would treat those things separately, which could influence the symptoms of FND, but it's not direct. The other treatment, as I mentioned before, is physical therapy. There there's just in general a shortage of providers who treat FND. There's a great website on FND Hope that has a provider directory all around the country. You could find providers who are local. So I do partner with physical therapists who help with the sensory motor integration aspects of things, will help to rewire those misfiring signals between the brain and body by working on exercises while the patient is distracted to show that they can actually do the task in a functional way while they're distracted, so they can rewire those circuits so that they're working more appropriately, since they can do it with a distraction task. And eventually, while practicing that, they can then develop skills to do it without the distraction task, just in their regular movements.
These are great techniques, great therapies. One thing it got me thinking of is, especially in this day and age of post-COVID, telemedicine becomes such a big deal, right? It enabled providers to really expand their reach. And on our side of things, we see a lot of clients that have developed transportation issues because they've been in a motor vehicle accident, or they just can't drive anymore because they have physical injuries. They have anxiety about going out of the house. Are you seeing a lot of your clientele utilizing telemedicine? Is that something that's helping people overcome that stigma of therapy where they can do it in the privacy of their homes?
Yes, definitely. I think telehealth is a great tool in general. I am licensed in multiple states, so I can do telehealth more than just in Philadelphia, where my physical practice is. I do like to see patients in person for the first visit, just because there are certain examination maneuvers I need to do that would require me touching physically the patient. But with that said, I do think that a neurological exam over telehealth is very strong, and a lot of times these things can be diagnosed by visualization only. In terms of psychotherapy, I provided in person and telehealth psychotherapy sessions. I felt like It's patient preference more so, just which they would prefer. I think there's a convenience factor of doing it over telehealth. And additionally, as you mentioned, I have patients who could have to use a wheelchair to get to our appointment. People who have seizures, even functional seizures, can't drive. Their license is typically revoked if they're having seizures that infect their awareness and consciousness. So they'll actually not be able to drive into the center. So I do think telehealth is great for not just this neurological disorder, but many ones.
Yeah, thank you for that. I always love to call that out when I can, especially when I have, providers, on these podcasts, just because a lot of our listeners, they're just looking for that little grain of hope. And I think sometimes people forget about that capacity that we have these days. So I appreciate you kind of expanding on that a little bit. Let's talk about outcomes. You've really gone through the list of, what is FND? How might you approach treating that? What kind of outcomes are you seeing in the treatment of functional neurological disorders?
And that's one of the good things about why I like to work with this patient population is that even in a short amount of treatment on the realm of several months, we could see very drastic recoveries. Somebody who can't walk can walk again and walk out of your office and not have symptoms anymore. People who are disabled can't drive because they're having seizures, free from seizures for years. So it is treatable with this combination of psycho and physical therapy. I think that's one of the rewarding parts of the job that I have in working with this special population. And on average, I will say that about 2/3 of patients will respond to the treatment, go in remission, or not have recurrent symptoms. Sometimes people who have remission of their symptoms can relapse, so we do see that. I tend to see that if there's times of recurrent stress or other issues going on in the life that could, create the symptoms to recur. But in general, the treatment is very well tolerated and is quite effective.
Let's go back to providers. We kind of mentioned that, it really kind of takes a specialist to dig down into some of the levels necessary to diagnose, to treat. Why is it important that there are, providers out there that are affirmed in order to treat disorder? How do we go about doing that?
Yeah, I think that's something that is important, that we advocate for this patient population because there's this stigma and misunderstanding. So I think having more doctors who will speak out and educate and create awareness is important. I think education is important. This is not a disorder that's often learned about much in medical school. I think oftentimes because the neurologist is not the direct one providing the treatment, neurologists will provide the diagnosis and then send them elsewhere. But I do find that there will be a lot of questions that come up because you could see it takes a lot of time to explain it, and there could be follow-up questions. There might be need for follow-up to provide additional referrals or resources to the patient. And so to have the neurologist position to just be diagnostic and not a partner in the full treatment plan longitudinally, I think is doing a disservice to the patient. So I think there needs to be more interest just in following these patients from the neurology side of things as well. That not always is the case.
That's amazing. That's great. Well, everybody, that is going to do it for another amazing episode of Mind Matters, Navigating Head Injuries and Concussions. Again, I want to thank today's guest, Dr. Mackenzie Lorario, for joining us again and sharing knowledge and passion with us. If you didn't catch the first episode, please go back and watch that. You will not be sorry. You can find Dr. Lorario again practicing in the Philadelphia area and in multiple published articles throughout scientific journals. I hope that our audience has really enjoyed this enlightening discussion today. Please don't forget to hit that like button and subscribe to our channel so you can keep up with our newest and latest content. And also leave us a comment on today's discussion. Let us know what you thought. And as always, remember, if you're in pain, call Shane at 980-999-9999. Thanks for watching. See you next time.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.